Dr. Mark Weisberg, welcome to Shrink Wrap Radio.
Thanks. Nice to be here.
Well, it's great to have you on the show. You're a health psychologist. And if ever there was a time when we needed to hear from a health psychologist, I would say this is it.
Yeah, it's really unprecedented and interesting that the role for psychologists and clinical health psychologists in particular now has never been more pressing or more interesting.
Yeah. I think when most people think about psychologists, the first thing that comes into mind is a clinical psychologist. And they
Hmm.
may not be aware of health psychology as a field within the broader field of psychology as a specialty.
Hmm.
So perhaps we should begin with you telling us what is health psychology?
Sure. So a clinical health psychologist is kind of a relatively newer subspecialty of clinical psychology that
Okay.
emerged in the past, 20, 25 years. And it's a merging of everything we think of in clinical psychology, looking at psychopathology and depression, anxiety, phobias, trauma, things like that, and merging it with health and illness, um, neurophysiology, anatomy, genetics, um, and all those factors about how physical and psychological health and illness interact. And both to understand how those things happen and also how we can intervene in helpful ways.
So it sounds like you have to know even more than the average clinical psychologist knows.
Well, it's a good field for people who are curious and like to learn about several different areas. So clinical health psychologists, in addition to doing psychotherapy, will also often consult in various kinds of medical and dental settings. So for a number of years, I've been one of the co-owners of a head and neck pain clinic where we have not only psychologists and physicians, but also dentists who specialize in TMJ and craniofacial pain, headaches, that sort of thing. Working in chronic pain, working with cardiology, orthopedics, dermatology, really just about every medical specialty.
Wow.
You can find clinical health psychologists that interact with those groups.
Yeah, yeah. So tell us about your background and your training, if you will. And I think we have plenty of time for what we're going to be talking about.
Okay,
So,
sure. So initially, my initial interest was in clinical psychology. So I got my doctorate. Uh, and when I was looking for clinical psych programs, my interest at the time was neuropsychology,
uh-huh.
which is kind of the study of brain behavior relationships.
Yeah, very
And
hot field right now.
yeah, and at that time, there was someone up in Windsor, Ontario, Canada, named Byron Rourke, who was uh, a big name in the field at that time. And so I went to the University of Windsor to study with him and eventually kind of broadened from neuropsychology into clinical psychology more broadly. Finished my doctorate there and interned at a hospital in Kansas City and then a hospital in Minneapolis, St. Paul, where I'm from. And then moved back to the Twin Cities after my doctoral training. And first, in Minnesota at that time, you had to work 2 years postdoctorate to get licensed. So I worked at a hospital and an outpatient clinic for a couple of years. And then once I got licensed, started my private practice. And also that's when this Minnesota Head and Neck Pain Clinic was just getting off the ground, and they pursued me about joining them as well. So I started with them 1 day a week, which I've done for the last 30 years, 33 years actually, and just stepped down from the pain clinic in this past year to free up some time for writing my second book that I'm in the process of writing now, and then currently I do my private practice 4 days a week.
And what was your first book?
My first book was called Trust Your Gut. It is a consumer's guide, an integrated medicine guide to understanding and treating digestive disorders, and particularly IBS, irritable bowel syndrome, gastritis, GERD, and how to be able to address those conditions as a consumer without medications. And I co-wrote that with a friend of mine who's an integrative internist. And that book came out in 2013.
Well, I know that's a real hot field as well right now, is
Yeah,
the how much the gut, the bowel, all of that
absolutely.
impacts not just our physical health, but also our mental health.
Absolutely. Our book had come out uh, just about well, I should say, as we were writing it, the first research about the microbiome came out.
Yeah, the microbiome.
The inner environment of
Right.
the gut bacteria that we're learning is so important for not only gut health, but our immunity. And so we were able to jump on that right from the start and include that into our book. And so it's an exciting field. And
Yeah.
clinical health psychologists and working with digestive disorders, there's a big, big demand for that.
Yeah, I've interviewed a couple of other people in the integrative functional medicine kind of field that
Hmm.
were focused on that. Where are you with the probiotics? It seems like we get mixed messages about whether we should all be taking probiotics or not. I
That's,
was, and more recently I've stopped.
yeah, that's a really good question and an interesting question. For many people, as we've learned more about the microbiome, we find that many people are deficient in some of those beneficial bacteria. So probiotics as a supplement for some people can be very useful. If you have a well-balanced diet, you may not need them. Some people find them constipating, but for others find it really helpful. It's interesting to note too that things like stress levels, depression, anxiety can deplete the amount of beneficial bacteria in your gut.
Ah,
And so that's where probiotics, as well as other kinds of self-care practices, can be really helpful for kind of maintaining a healthy gut flora.
okay. Well, let's talk about the elephant in the room, which is COVID-19
Yeah,
pandemic.
yeah.
And to start out, how has it impacted you both personally and professionally?
So very interesting. Up until a few weeks ago, um, it was kind of surreal because fortunately my loved ones, my family, my friends um, were all healthy and well and nobody was affected, although we're hearing the, of course, terrible reports of what was happening nationally and worldwide. Um, about 3 weeks ago, my uncle, who is in his 90s, was diagnosed with it and died within a few days.
Oh my goodness.
Um, but so that was tragic, of course. But other than that, um, knock on wood, loved ones and family and friends so far are doing fine. I have a friend of a friend who's a ER physician locally, and he got it right in the beginning.
Wow.
But he went through a couple of rough weeks, and now he's presumably has immunity and is back at work.
Yeah.
Um,
I have a son who lives in Manhattan, right in the heart of a lot of it. And he got it early on, sheltered in for 14 days and got over it. You know,
oh, thank
he's
goodness.
in his 30s and very healthy. And
Good,
yeah, so
good.
that made it more real for me, for sure.
Sure, absolutely. Well, I'm glad he's doing better.
And then at the same time, even after that close call, there's a way in which I'm kind of numbed out to the numbers, that we're constantly hearing about these numbers that are staggering and hard to take in. And it's hard
It's
not to just feel like, oh, well, that's somebody else. So,
Oh, absolutely. It's so easy to numb out because the numbers are so mind numbing.
yeah,
Uh, but knowing someone that's been affected sure brings it home in a different way.
yeah.
Um, but professionally, it's been interesting as well. Um, at first, many of my patients didn't seem that affected by it, which was interesting. I kind of remember going back to 9/11, when I thought many more of my patients would be thrown by the trauma of what happened in 9/11.
Uh-huh.
Interestingly, back then, I found that except for those patients who had a history of trauma or PTSD, most of them were saying like, well, that's tragic, it's too bad, now let me get back to the issues I was working on.
Yeah.
What's happened here, though, differently, I find, is that because it's happening to everyone across our country and across the world, and that we've all been in this kind of unique situation of self-quarantine, I think what's happened is that I'm finding in general that I think the kind of ubiquitous stress of COVID is making it such that for all people, whatever vulnerable points they have are starting to get tweaked, starting to get exacerbated and worsened to some extent. So those patients of mine who suffer with depression, that's a little bit intensified.
Uh-huh.
Those patients of mine who have anxiety or are hypervigilant, their hypervigilance is now spread to, well, what happens to, did I wash my hands after that doorknob? What happens when I pass that person? Am I going to catch something? Struggling with that balance between what's realistic fear and unrealistic fear.
Yeah.
So I find for everyone, it's taking whatever their vulnerable area is and kind of intensifying it a little bit.
Yeah, that's what I've been suspecting and kind of sensing. And so if any other examples come to mind as we're talking.
Yeah, I think an issue that's come up for many of my patients, as well as colleagues' patients, is the issue of how do you assess risk? It's tricky, isn't it? Because we have these CDC guidelines, which are changing, from some of them from week to week. You got the World Health Organization and their guidelines.
You're talking
You
about
have
age and other pre-existing conditions and so on.
right.
Yeah.
Then you have government giving some very confusing, especially national government giving some very confusing directives about what is or is not risky, which I think confuse a lot of people,
Yeah.
and worry a lot of people.
Yeah, I was going to say that only increases the anxiety, right, of getting mixed messages. You've got national messages, you've got state messages, maybe even more local messages.
Yeah,
Who do you,
absolutely.
yeah,
And in Minnesota, our governor here, Governor Tim Walz, has been excellent in terms of really behaving the way you'd want a leader to behave. They give
wonderful. Good.
daily news briefings. They're fact-based. They're about actionable information. It's fostering realistic hope without unrealistic promises, urging people to stay safe, but empowering them to be hopeful and to start to now move out into the community slowly and gradually and sensibly. And I've heard from many patients that after hearing all the confusing information nationally, that it's very reassuring and comforting to have some local leaders, like our governors, who are providing real substantive leadership and good information.
Yeah, our governor here in California, Gavin Newsom, has performed similarly. And
Heard good things about him.
yeah, really looks good. You know, we're thinking, oh boy, he'd be a good presidential candidate, you know, based on his track record here. But by the time this is over, he may be burnt out, not wanting to serve to get even more responsibility.
Oh, yeah.
Yeah. And also we've had a county supervisor who's done daily updates, and she's also been quite impressive. Well, we were talking before we turned on the mic and got started officially. You mentioned that your practice is changing a bit in terms of you're going to start. It's all been telehealth up to this point, right? Zoom.
Yeah, I mean that's been an interesting journey as well. When I first decided back in March, when we were all getting strong recommendations to not be meeting patients in person, even though technically as psychologists, we were deemed an essential business, so we could see patients if we wanted to. But most colleagues and what I was reading was recommending not to do that, at least then. So when I told my patients that I was going to move to telehealth, interesting reactions. I'd say about 70% said, okay, yeah, that seems fine. About 10 or 15% were saying, oh, good. I really like that. Then I don't have to take the time to drive to the office. And actually, some of the patients who struggle with anxiety or going out in public actually like the fact that they could stay in their house and do it.
Yeah.
And then there was a small percentage who said, it really just doesn't feel helpful for me sitting in the office with you in person. It doesn't feel right by telephone. It doesn't feel right by video. And I'm going to, as much as I want to continue, I'm going to wait until you're back in the office.
Uh-huh.
And in fact, I had a couple of patients whose work involves being on teleconferencing all day, who said, I got to tell you,
No
after
more.
10-hour days of teleconferencing, the last thing I want to do is spend another hour teleconferencing with you.
I totally understand that, because
Yeah.
I find that my limit in this modality is about an hour typically. And then I begin to just get kind of brain dead somehow. But it must feel good, though, to have people are saying, well, seeing you in person means so much to me that I won't accept anything else.
Well, it feels good. I think it just also speaks to something I'm sure you've thought about and spoken to some of your other guests about, which is, I think those of us who do psychotherapy as well as clinical health psychology recognize that the nature and the quality of the therapeutic relationship is the number one variable, of course, that predicts success. And people vary, of course, in their ability to form attachment. And what allows some people to form attachment is different. And for some, being in person is what fosters it. For some, having the distance of a video screen or a telephone might even be helpful. So I think it's for some, it's different for different people.
Yeah. Yeah. Speaking of Zoom meetings, I'm wondering if you've been getting any sort of training updates for dealing with this situation that we're in, if they've been in any sort of special Zoom meetings or anything run by professional organizations, anything like that going on?
There is some. Frankly, I've been so busy with between my own practice and writing that I haven't availed myself of any of them. I'm sure there's some out there, and I'm sure it's only going to increase. But Dave, part of what's interesting that I've encountered with some patients around COVID, there are, especially earlier on in March and in April, I'd have some patients who come in and just being so distraught, or on telehealth telling me that they're so distraught, saying, my God, there's these thousands of people dying, millions of people contracting the virus. And now on top of it, look what's happening to the economy and unemployment. And I've had some patients who are stockbrokers and were in a panic about, is the stock market going to fall apart? And so you've got this double whammy of health fears and financial fears. And that they're going, oh my God, what is there to hold on to? And you can understand where they're coming from.
Oh, yeah.
And I think for me, again, having been able to go through some national emergencies before, whether it was the Great Recession of 2008 or 9/11, has brought me a little bit of comfort, at least knowing that we've been through tough things before, and I believe that we'll make it through again. But There's another piece that I found helpful too, which is some of my mentors and what they've taught me about times like this, whether it's about a pandemic or a national emergency or a personal crisis or trauma. That when someone's worried about how can there be any kind of hope for anything tomorrow, something that I was told once, which I remember and is quite helpful that I share with others, is that, you know, whatever has happened in the past, every morning we are presented with a new day, just like a new blank canvas, and we get to choose what we make of it, what we create with that day. And no matter how bad the news is, we all have the opportunity and the responsibility to do that.
Yeah. Okay, good. I'll be looking for any other hints about staying sane.
Yeah, I think another aspect too has to do with realistic hope versus false hope.
Say more about that.
Anyone who's in the healing professions, I'm sure you've encountered this, and all clinicians who work in the healing professions have dealt with this at some point. For me, as a clinical health psychologist, I'm working even before COVID with chronic pain and people who have had horrible back pain, leg pain, neuropathic pain, headaches that have been debilitating and last for years. And they've been to so many different providers looking for help. And despite well-meaning providers' efforts, they're no better. And so they come to me with this orientation that says it's kind of hoping for the best but expecting the worst. Expecting that, well, you know, you're probably going to once again look at my history and then try some things, and then it's not going to work out.
Uh-huh.
And so I think one of the toughest things for anyone in the healing professions at any time, but especially now with COVID, is to be able to meet a patient where they are. And when the place that they are now with COVID may be profound anxiety, profound despair, hopelessness, and then to have that also be reinforced by just turning on the television and just being bombarded with, you know, mind-numbing figures about all the deaths and diagnoses and problems. We have a fine line that we need to navigate, I think, which is, on one hand, to be present to their suffering and to witness it and to validate it. On one hand, not to get overwhelmed by it ourselves.
Yes, really.
And on the other hand, not to go numb and distant and go, well, too bad you're dealing with that. You'll get over it.
Yeah.
That middle ground. I remember a number of years ago, I was recording a training video using clinical hypnosis with a particular patient for some somatic concerns. And I had a recording crew in the office. There was a cameraman and a sound person. And we did this session working with hypnosis with this patient for this cardiac pain. And at the end of the session, the patient left. And we stopped the recording, and the sound person and the cameraman were both sobbing, were crying.
Oh,
They're like, oh my God, that's so sad. How can you be with that every day? And I was reminded, you know, we witness this suffering daily. And sometimes it's easy to forget just how profound the level of suffering that we're encountering, especially now with COVID and people who are terrified both for their own health, the vulnerability of their own health, as well as for their livelihood.
So what do you do personally to put yourself in that place? How, you know, what's bringing you through?
Right. So I'm reminded of what the flight attendant says when our plane is taxiing towards takeoff. And they go through that whole list of things, and they say, of course, in the loss of oxygen, an oxygen mask will come down. Be sure to secure your own mask before you help someone else.
Yeah.
And so to me, self-care at a time like this is always important, but never more important
Yeah,
than now.
yeah,
And so for me, all the things I do for self-care before I step into the office, um, rest, sleep, uh, meditation, and self-hypnosis practice. For me, getting physical exercise is absolutely essential for my sanity.
yeah,
So I love to bike, road bike, and so I try to get 20, 30 miles in several days a week.
yeah. Good for you.
Um, I'm in a loving relationship with my significant other, and that's a source of ongoing support and nurturance. Do Zoom happy hours with friends and with my family, both local and out of town. Have started to do some social distancing gatherings with some friends, where we'll meet 6 feet apart and we'll each bring our own food.
Uh-huh.
And so that type of support and interaction, to me, I wouldn't be able to do this work
Yeah,
without.
yeah, yeah. Even people who are sort of non-clinically, uh, who don't have clinical issues, I think, are experiencing psychological changes as a result of those who are sheltering in and who are continuing to shelter in, as am I.
Yeah.
Uh, have you seen any the things I'm noticing are a changed sense of time and a paradoxical, for me, a paradoxical sense of time is moving slowly, but this whole thing, I mean, the weeks and months have gone by very quickly.
Oh, absolutely. In clinical hypnosis, one of the hypnotic phenomena that you work with is called time distortion,
Yes.
where you'll actually give suggestions for time to either feel like it's passing much more slowly or much more quickly. And you can imagine how some of that's helpful if someone's having a surgical procedure to give suggestions that the time will go quickly. But wow, the natural time distortion that's happened with all of this has been incredible. Um, Myself and friends and so many other people have commented about how it's made time go very slowly, and even just how the days start to blend together.
Mhm.
So I was joking with my patients last week. Yesterday was Memorial Day, and I worked. And when I was talking about scheduling with my patients for yesterday, I said, I'm wondering if you want to schedule for Memorial Day, or as I call it now, Monday. It's just another day.
Right. Yeah.
And yeah, it seems for so many people, the days just kind of blend together. And I'm seeing even non-clinicians, just friends and family, there's more irritability, um, more impatience, more anxiety, more for some people who are prone towards kind of having the glass be half empty, uh, kind of an I told you so, like, you see, this politician said this stupid thing, and see, I told you things are falling apart. So I see a lot of that happening too.
Yeah. Yeah. Um, you mentioned the self-hypnosis and meditation. Um, maybe maybe you give us some suggestions for people in the audience about how they might, do one or both of those.
Yeah. So a few thoughts, and then I'll talk about some resources where people can find out more about it.
Good. Good.
Um, so to me, Dave, that gets back to that issue of fostering realistic hope. And I'm very conscious of not wanting to be a cheerleader or trying to talk someone into hopefulness when that is not what they're experiencing.
Uh-huh.
And so my goal really during this time of COVID, but really with all my patients anyways, how to foster realistic hope. And one of the ways I try to do that is in current time, real experience with my patients during an appointment. So things that I do with them to foster a sense of calm or comfort in their body. Something like even doing a brief breathing technique. Would you like to hear an example of one?
Sure.
Yeah. So this is one of the places where where I've done consulting is with Andrew Weil's program in integrative medicine at University of Arizona Center for Integrative Medicine.
Yeah.
And Andrew Weil publicized a breathing technique which came from a yogic tradition, but that I use, and I've kind of altered the count to what I call 4-4-8, which is, and maybe everyone could just do this. The whole thing will take 2 minutes.
Okay, I'll do it.
Let me, if I may,
model.
let me invite you to have this experience. So I'll introduce it to you just the way I introduce it to a patient. So what we do is, what we're going to do is we're going to inhale for 4 counts through your nose, hold it for 4 counts, and then exhale for 8 counts through your mouth. And so I'll demonstrate it once, and I'll show you the counting. So it looks like this. First, I inhale, hold, exhale. Okay? You try it out once, and I'll do the counting for you. Okay? Inhale, 1, 2, 3, 4. Hold, 2, 3, 4. Exhale, mouth, 3, 4, 5, 6, 7, 8. Okay? Now you try it once and do the counting internally this time. Okay, and so now I forgot to ask you this beforehand, but rate your tension level right now on a 0 to 10. 10 being highest, 0 being none at all. And you can just keep it to yourself.
I'm thinking about it.
You don't have to share it with me, but just pick a number.
Yeah.
And now that cycle of in for 4, hold for 4, and out for 8, I'm going to ask you to do that just for 2 minutes.
Okay.
A couple of things while you do it. Better with your eyes closed if that's okay.
Yeah.
And secondly, while you do it, be sure to keep your attention focused on the numbers. So I want you to either hear the numbers 1, 2, 3, 4 or see the numbers 1, 2, 3, 4 as you do it. And just go ahead and focus on that, and I'll stop you after you've done it for 2 minutes.
Okay.
Okay, when you're ready, go ahead. Okay. Take a moment now and again, just scan very quickly and get a sense of where you'd rate that tension level now on the 0 to 10. And did it go down from where you started?
Yeah, I think so.
Good.
I think so.
When I teach this, any time that I'm speaking or presenting at conferences, I always do this early on. And I'd say about 98% of people will notice a noticeable shift with a reduction in tension. And that's really important in a lot of ways, in part because um, one of the ways we foster realistic hope is to be able to notice that something changed for the better, even if it's a small change, and to be able to go, okay, and just as this changed, other things can change too.
Yeah, one thing that I notice about it too is it brings you into the present.
Yes,
So you can't keep the count and also be worrying about what's going to happen tomorrow or
that's a really important point.
yeah,
And all the all the ancient wisdom, traditions of wisdom over the centuries have preached the importance of staying in the present moment.
yeah.
And I think that when we're feeling better, we tend to do that naturally.
Hmm.
It's more that when we're struggling with anxiety and depression, um, we tend to, either focus on the past or anticipating the future.
Yeah.
So getting back into the present is helpful. And, another thing that I recommend to my patients who are struggling with fears about COVID, one of the first things I'll recommend is be very careful and mindful about where you get your news. Um,
And
I've
how
had
much of
so
it,
and
how
how
much of it
much
you're
of it.
getting.
I point out that today with the 24-hour news cycle and cable news and streaming news, so much of what we hear is not news; it's opinion, and a very small amount of it is actual information.
Yeah.
And so, for many patients, I've advised that you can help yourself tremendously right off the bat by turning off cable news. And if you want to, of course, you want to be informed, but be mindful about how you get it. Whether you go to BBC World Service or maybe some people, like National Public Radio as a kind of, there's different places to get it where it's more information and less opining about things. And as you point out wisely, set a time limit. You know, 5 or 10 minutes a day should be enough
Yeah.
to get brought up to date on the headlines of what you need to know.
Yeah. Yeah. Exactly. Yeah.
In Minnesota and maybe in California too, and some other states, the governor has a daily briefing. In Minnesota, Minneapolis, we have it. I think it's 2 p.m. local time, where the governor gives us an update. And here again, it's useful, constructive, actionable news. And I recommend that also as a place to get good information that's not inflammatory.
Yeah. Yeah. Good advice. Now, you had mentioned before we got started that you're going to start having people come into your office after not having done so for a long time.
Yeah.
Yeah. Uh, Share that with our audience, if you will.
Yeah. So actually, I'm speaking with you today from my office, and this is the first day of my being back in the office.
Oh,
I share an office with a colleague, and we talked over what would be reasonable guidelines. And so we decided on making a few changes. For one thing, she and I are physically in the office on different days to begin with. And we also are staggering our appointments. Hers are generally on the hour and mine are on the half hour, so that our patients won't all be in the waiting room at the same time. We've removed some of the waiting room chairs and spread them out. Um, we've always had, hot water, cold water, and tea available for patients. And hesitatingly, for now, we've decided to take that out, for safety reasons. And we've also taken out the magazines. For now, and then we will have patients sign a waiver acknowledging they understand that they're going to be mindful of their own health, they're going to be careful, they're going to not come in the waiting room until 5 minutes before the appointment. They're going to agree to monitor their health and take their temperature, and that if they will sure to notify us if they become ill with COVID. to not come in and switch to telehealth. Of course, my colleague and I have also pledged to our patients the same thing, that
Yeah.
if either of us were to become ill or become in direct contact with someone who's ill, that we would notify everyone and then go to telehealth.
Will
And then with that, I'm having patients come in one day, Tuesday, for starters, and I'm able to see them with distancing. You know, I open and close the doors, wipe down the chairs and the handle to the office in between patients, and we're starting off like that and seeing how it goes.
will you or your patient be wearing a mask?
Good question. I thought long and hard about that because it's an interesting issue.
Yeah.
Um, I should preface this by saying that when I'm out in public, if I'm in grocery stores or other shopping places, I wear a mask. I
Yeah.
think that's important. I think we kind of have a social responsibility to one another to
Right.
do that until we know more fully about how this virus is spread. That being said, wearing a mask is interesting when you're doing psychotherapy or psychophysiological treatment, because we talked before about what fosters that connection
Yeah.
between doctor and patient. And of course, facial expression is such a huge part of how we read what's going on in each other, both for me to see what's happening with the patient and also for them to see my expressions as well. And so what I decided to do after talking to some colleagues is that I'm leaving it up to the patient, and I'm telling them, because of this issue, I'm going to leave it up to them. If they want us to wear a mask and feel more comfortable, I will wear a mask along with them. If they don't feel a mask is necessary, we will meet without a mask.
Uh-huh. I was thinking about maybe starting off with a mask. I assume you'll be at close proximity when they first come in.
Well, actually not. I mean, my office is set up so that they can walk through the waiting room, and we have an inner hallway so that I can stand back certainly 6 feet or more as they
Okay.
walk into the office. And then I open and close my office door. And then when they leave, I certainly have, my office is large enough that I can certainly stand back at sufficient distance so that we never are closer than 6 feet.
Okay. Excellent. Well, I wish you well with that, and as you kind of ease back in. And
Yeah.
I want to thank you for being my guest today. Is there anything else that we haven't touched on that you'd like to share?
No, well, for one thing, I want to just thank you for what you're doing. These interviews with various clinicians, I think, is providing a wealth of information about important topics in clinical psychology and clinical health psychology. I want to thank you for the good work that you're doing
Well,
in
thank you.
making this information available to such a wide audience. I would also just add that if anyone has further interest in clinical health psychology, integrative medicine, or any of my work with any of my trainings, books, or workshops, they can reach me at www.drmarkweisberg.com, where there's listings about upcoming workshops, podcasts such as yours, and upcoming trainings as well. Oh, and for people who are interested in meditation and would like to avail meditation for self-care, there's several great apps right now that are available in the Apple Store or Google apps. One is called Insight Timer.
Uh-huh.
It's a free app, and it has a plethora of hundreds of different meditations, from ones that are 2 minutes long to ones that are an hour long. And you can download, and they're all free, and you can listen to whatever length. So that's a really great resource for meditation.
Yeah.
For anyone listening to your website, to your podcast, who are clinicians who'd like to learn more about clinical hypnosis, a really great resource is the American Society for Clinical Hypnosis. Their website is asch.org. and they have great information about how people can start to get training in clinical hypnosis.
Yeah, I was a member a long time ago.
Oh,
Lapsed. But yeah. Okay, well, again, Dr. Mark Weisberg, I want to thank you for all the information you've shared with us and for being my guest today on Shrink Wrap Radio.
thank you. It was my pleasure.